Okay, welcome back. This is chapter 18 dealing with blood vessels, and we'll talk about their anatomy, their distribution, their function, and their composition. So, we have to understand that in the human body, we have something called a closed circulatory system in which the blood that flows through the body for the purposes of exchange of nutrients, oxygen, waste products, the distribution of hormones and immune components, um, is in a closed system. So it's always either inside a blood vessel or it's inside the pump that drives the movement of the blood, which is the heart. We have three main kinds of blood vessels. Um, in the circulatory system, we have arteries that always carry blood away from the heart, veins which always carry blood back towards the heart, and we have capillaries, which are numerous thin-walled blood vessels, which are designed for the exchange of nutrients, waste products, and gases, oxygen, CO2, across the extremely thin walls. And this happens at the level of the tissues, um, both throughout the body and also, more importantly, um, in the lungs. The two branches of the circulatory system are the pulmonary and the systemic circulation. The systemic circulation starts with blood returning, um, or blood leaving the heart from the left ventricle and entering the aorta, at which point it flows out to the rest of the body. We engage in exchange of waste products, nutrients, CO2 and oxygen, and then we return to the heart via the superior and inferior vena cava and the coronary sinus into the right atrium. Okay? The pulmonary circulation begins with the exit of blood from the right ventricle into the pulmonary trunk to the pulmonary arteries, and from the pulmonary arteries we go to the lungs, and then we receive oxygen and release CO2. The blood turns from a dark to a bright red, and then it returns to the heart via the pulmonary veins into the left atrium. Okay? So the pulmonary circulation is an extremely short system between the heart and the lungs, and of course they're right next to each other, and as a result it's a low pressure system. And systemic circulation is a high pressure and much longer system between the heart and the rest of the body. So the types of blood vessels are shown here. As blood leaves the heart, it enters arteries. Arteries eventually get to arterioles, which eventually empty into capillaries. Capillaries then coalesce into venules, which drain into veins, and then those go back to the heart. Okay? The arteries tend to have more muscular walls and blood under higher pressure, and the veins have less muscular walls. They tend to be, on average, larger in diameter, and they contain valves to promote the one-way flow of blood back to the heart, due to the fact that the pressure in the veins is quite low, and so we have to utilize other mechanisms to get blood back to the heart. Otherwise, the blood's going to tend to pool in the lower extremities due to working against gravity. The three layers of a typical blood vessel, save the capillaries, are the tunica intima, media, and the adventitia. So the intima is endothelial tissue, simple squamous epithelial tissue is going to be coated with something called prostacyclin, which acts like a repellent for the formed elements of blood so that they don't snag and rupture on the walls, the inner walls of the vessels. The middle layer, the media, is smooth muscle tissue, which is under the control of the sympathetic division of the autonomic nervous system. and can control not only the blood pressure by vasodilation and vasoconstriction, but can also control the distribution of blood through a process known as vasomotion. And then finally, the adventitia is connective tissue that latches the blood vessel in place so it doesn't twist, buckle, or kink. In some of the thicker walled vessels, such as the aorta, which is the biggest artery in the body, we actually have blood vessels that supply oxygen and nutrients to the wall of the vessel itself, called vasa vasorum. And that's because the walls are so thick at that point that they can't utilize the oxygen and the nutrients that are contained in the blood that they carry. The other vessels, which have thinner walls, can do so, so they lack vasa vasorum. So you can see here how the layers are arranged. The smooth muscle in the arteries is more extensive because it has to be used to direct where the blood flows, and also is used to control blood pressure. Okay, so this is going to respond to sympathetic autonomic input. Okay, and then at the level of arterioles, we will respond both to autonomic input, but also to the chemical needs of the tissue. And so in the systemic circulation, as ATP and phosphate levels build up, as pH drops, as CO2 levels rise and oxygen levels drop, what happens is that we tend to open up the smooth muscle that allows blood to flow into capillary beds, and we perfuse those tissue regions so that they get the blood they need. And then in conditions where the tissue is well nourished, the oxygen levels are high, the CO2 levels are low, etc., we do the reverse. So at any moment in time, about 3/4 of the capillary beds of the body are closed up, and a quarter are open, and then we switch off which vessels are open or closed depending on the metabolic needs of the tissue. And that's important because that helps to, among other things, maintain our blood pressure. If all of our capillary beds were open at the same time, then our blood pressure would drop to the point where we would pass out. Large arteries are thick, tough, and elastic because they have to withstand high pressure. The arterioles can contract and relax and control the radius of the vessel. As a result, they're called resistance vessels. The smaller the radius of the vessel, the greater the resistance and the smaller the flow. Capillary single layer is for exchange of nutrients, waste products, CO2, oxygen. So they're called exchange vessels, and they're so numerous we don't even bother to name them. And venules and veins store blood and return it to the heart, and so they're termed capacitance or storage vessels. You can see here some of the main blood vessels. Okay, the aorta is the lead into the systemic circulation, and the first portion of the aorta is called the arch. There's an ascending aorta, there's an aortic arch, and there's a descending aorta. Okay, the location within the body determines what we call the aorta. In the chest, it's called the thoracic aorta, and in the abdominal pelvic region, it's called the abdominal aorta. Okay, you can even see some of the other main branches that come off. First branch off of the aortic arch is the brachiocephalic artery, which is going to branch into the right common carotid heading towards the head, neck, and brain, and the right subclavian that's eventually going to head into the arm. Okay. Then we have the left common carotid and the left subclavian, which mirror the pathways that the right common carotid and the right subclavian take on the other side. And then as we drop down through the chest behind the heart, we give off intercostal arteries, which go between the ribs, and then we go through the diaphragm, into the abdominal pelvic region, where the celiac trunk provides blood vessels that go to the liver, the stomach, and the spleen. And so those are called the hepatic, the left gastric, and the splenic arteries. We move down further. We have the superior mesenteric, then the renal arteries, which are just below the adrenals, and then the inferior mesenteric, and then the gonadal arteries, and then finally, when we get down to the end of the abdominal aorta, we have the two common iliac arteries that branch off and serve structures in the hips and the lower limbs. So you can see here, again, the listing of the arteries that supply each. We've already detailed where these go. If we follow the subclavian artery, subclavian artery indicates that the vessel passes under the clavicle. In the armpit, it becomes the axillary artery, then the brachial artery in the arm, and then it's going to split into the radial and the ulnar arteries. Okay, and in some people, there's a median artery. And then in the hand, it's going to form the superficial and deep palmar arches, and then the digital arteries. Okay. The common carotid artery is going to split into the internal and the external carotid. The internal carotid is going to feed the brain by pumping blood into a structure called the circle of Willis, which is on the underside of the brain. And the external carotid is going to provide blood to the face and to the scalp. And then the intercostals provide blood to regions between the ribs as the aorta continues to descend down the thoracic region. And then when we break through the diaphragm, we have the three branches of the celiac trunk, delivering blood to the spleen, the liver, and the stomach. The superior mesenteric that serves the entire digestive system up to the descending colon. The adrenal arteries that serve the adrenal glands. The renal arteries serve the kidneys. The inferior mesenteric serves the descending and sigmoid colon, the rectum, and the anus. And then the gonadals serve the testes in males and the ovaries in females. And then finally we get down to the common iliacs, and they're going to split into the internal and the external iliacs. The external iliac continues into the leg as the femoral, and the internal iliac remains in the pelvic region and supplies blood to structures that are contained inside the coxal bones. Okay. The femoral artery will continue behind the knee as the popliteal, and then will split into an anterior and posterior tibial artery, as well as a fibular artery. And then in the foot, it'll form the dorsalis pedis, and off of the pedis will come digital arteries into the toes. Okay. So those are the branches and where they go. The mesenteric arteries get their name because they pass through mesentery, which is connective tissue that attaches the digestive system to the body wall. Okay? So it's a passageway for nerves and blood vessels and lymphatics to go to and from the digestive region. Okay? You can see here, again, the remaining blood vessels that branch off. Okay. Now, if we come back to the heart, blood coalesces from capillary beds into venules, into veins, and then the main veins that supply blood to the right atrium of the heart are the superior and inferior vena cava and the coronary sinus. Superior vena cava drains the head, the shoulders, and the upper extremities, and the inferior vena cava drains everything below the heart, while the coronary sinus drains blood from the heart itself. And that's another important point regarding the aorta, which is that at the base of the aorta, the coronary arteries, the right and left coronary arteries, supply blood to the heart itself. Okay? So, draining into the superior vena cava are the two brachiocephalic arteries, uh, which receive blood from the subclavians and the jugulars, okay, um, which drain the brain. The subclavian receive blood from the axillary, which receives blood from the brachial, which receives blood from the basilic and the cephalic, um, as well as um, the the ulnar and the radial veins and the digital veins, and there are also um, palmar arches that drain the palm of the hand. Okay, so you're going from tinier veins to larger veins, ultimately back to the vena cava. Okay, remember that the pressures in these are relatively low, and the number of valves in areas above the heart is fewer because you're working with gravity to bring blood back into the heart, whereas in areas below the heart you've got more valves because you're working again against gravity. Okay. Then if we go to the inferior vena cava, we could start with the digital arteries of the toes draining into the dorsalis pedis vein, and then from there we're going to drain into the tibial vein and the fibular vein, from there into the popliteal, from there to the femoral and the saphenous veins. So there's both a great and a lesser saphenous vein, and those are superficial drainage in the leg and the thigh. Then those are going to drain into the external iliac, which will drain into the common iliac. At the same time, the internal iliac vein will drain to the common iliac, and then the renal veins, the gonadal veins, the adrenal veins, and the mesenteric veins will all drain into the inferior vena cava, the hepatic vein as well. Okay, and there are also going to be um, drainage from the splenic vein and the 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 mesenteric veins into a special blood vessel which is called the hepatic portal vein that drains into the back of the liver. Okay, so that's a special circulatory pattern in which nutrient-rich blood is directed into the hepatic portal vein from the digestive system so that the liver can treat the blood and then pass it into the hepatic vein. Okay, so that's a special circulatory route. And then as we continue up towards the heart, eventually the inferior vena cava is going to drain into the right atrium. Okay? We're going to look at some special circulatory patterns that provide blood supply to vital organs so that it's less likely to be interrupted. These special circulatory patterns often feature something called collateral circulation, in which there are alternate routes to a similar destination. In the event that one route is blocked, an alternate route can be taken by the blood to get to its target. So if we look at blood supply to the brain, we have two vertebral arteries that come off the subclavian, and then we have the internal carotid coming off the common carotid, which comes off the brachiocephalic on the right side and is its own vessel coming off the aortic arch on the left. The internal carotids and the vertebrals deliver blood to the brain. The vertebrals coalesce into the basilar artery on the front of the brainstem, and that empties into the circle of Willis. And the internal carotids also empty into the circle of Willis, and the result is collateral circulation to the brain, so that in the event that we're blocked, we don't lose blood supply to the brain, which would result in the death of brain tissue. So you can see the circle of Willis pictured here, and you can see the internal carotids and the vertebrals heading up to this region. So as an example, okay, if you were to get a block in um, in the circle, okay, then the blood that hits the block can back up, come around the other side of the circle, and access the vessels that come off the other side of the block, and as a result, the blood supply would continue uninterrupted to a large extent. Okay. Obviously, there's going to be some areas where if we block the feed, then the blood supply of the brain is going to be dramatically interrupted. Um, an example um, would be something like, um, say, blockage in one of the two common carotids. Okay, and if that were to happen, then even though you're still getting blood to the brain from the other common carotid, there's going to be enough of a drop in the flow and the pressure that it could result in the death of brain tissue. Okay? Then drainage. Okay, drainage from the brain comes from the internal um, jugular vein and from the vertebral vein into the subclavian. Okay, and then the subclavian is going to drain to the brachiocephalic, which is going to drain into the superior vena cava. Okay? Note that there are some regions in the body where blood vessels flow close to the surface, which are part of the systemic circulation in the arterial branch, and those are pulse points. Okay, so examples would be things like the radial artery near the wrist, the carotid artery in the neck, um, the femoral artery in the groin, dorsalis pedis on the top of the foot, and even you could probably argue for the axillary artery in the armpit. Okay, the danger with these is that if you cut them, the blood loss will be massive, and it could result in death in a short order because the amount of blood lost is difficult to compensate for. In the body, generally speaking, the veins run superficial and deep, while the arteries tend to run deep, with the exception of the pulse points. And so that's a design strategy that's going to allow blood flow to persist, um, even though you might say cut a vein and have some blood loss. The rate of blood loss is slow enough that eventually you'll form a clot and the hemorrhaging will cease. We talked about the circulation between the digestive system and the liver. The drainage from the digestive system comes from the superior and inferior mesenteric, as well as the left gastric, and then there is also a right gastric and a splenic, and those are going to drain into the hepatic portal vein. Okay, the hepatic portal vein goes into the back of the liver, and it's formed from the fusion of the superior mesenteric and the splenic, and then they enter the organ, and then they also mix with blood from the hepatic artery. And so you get a mix of nutrient-rich and oxygen-rich blood that percolates through the organ. And what the liver does to the blood is it adds clotting factors, basically clotting proteins. It adds complement protein, which aids with immune function. It adds albumin, which aids with allowing the blood to hold on to its fluid volume. And it adjusts the nutrient content, removes pathogens from the blood, and detoxifies the blood. And then once we do all that, we eventually drain into interlobar veins, into the central veins, and then from there into the hepatic vein, into the inferior vena cava. Okay, so the hepatic vein comes out of the top of the liver into the inferior vena cava. The hepatic portal vein goes into the back of the liver and receives blood from basically the digestive system. Okay. In the event that we have liver disease or blockage of the portal circulation, then what we get are fluid accumulation in the abdomen, okay, and esophageal varices, which are bulging veins in the esophagus. And this is often seen in individuals that have conditions such as cirrhosis, okay, where the liver is so damaged from excessive alcohol use and drug abuse that the scar tissue that forms impedes the circulation into the organ. In the fetal state, the liver and the lungs are not fully developed, and so we have to have blood bypass those organs and go directly into the inferior vena cava and from there to the heart. So how does this work? Well, there are coming off of the common iliac arteries. There are two umbilical vessels that are going to carry blood, these umbilical arteries, away from the heart and towards the placenta. Okay, and in the placenta, what will happen is that oxygen-poor blood will exchange oxygen and CO2 and pick up nutrients and dump off waste products, and then that oxygen-rich, nutrient-rich blood will return via the hepatic or the umbilical vein and is going to drain into the inferior vena cava by going through the ductus venosus, which passes under the liver and directly into the inferior vena cava, and then that blood will head via the inferior vena cava up to the right atrium of the heart, and at that point the heart has a hole in the inner atrial septum that allows blood to flow from the right to the left atrium. What will happen then is that nutrient and oxygen-rich blood mixed with deoxygenated blood as well empties into the right atrium. Is that when the right atrium squeezes, it'll enter both the left atrium and the right ventricle. And then as the ventricles squeeze, the right ventricle will send blood into the pulmonary trunk, and the left ventricle will send blood to the aorta. But the blood that goes into the pulmonary trunk, most of it will be diverted into the aorta because of the blood vessel that links the pulmonary trunk to the aorta, which is called the ductus arteriosus. Okay? So what that ensures is that we're able to get oxygen nutrient-rich blood to the rest of the baby's body without having to rely on the liver or the lungs to do any of the work. The reason the lungs are useless is because they're soaked in amniotic fluid at that point. They don't do any gas exchange. And the reason that we don't pass blood through the liver is because the liver's not fully formed. Okay? So what will happen then is that at birth, okay, the blood vessels that represent these bypasses as well as the foraminal valley will close because of pressure changes, and that'll restore the normal circulatory pattern in the newborn. In the event that that doesn't happen, those are called patent fetal structures, and they may have to be surgically repaired. Okay? In fact, a lot of times if we see heart defects that are incompatible with life outside the womb prior to birth, we can repair them by doing surgery in utero before the baby is delivered. And the advantage of doing that, not only do you fix the defect before the baby's born, but the surgical procedure heals with no scarring. The pulse points we talked about are basically to determine the heart rate. Okay, you do this by palpating areas where arteries come close to the surface over bony prominences and counting the number of pressure changes per minute. Okay, so this allows you to determine the adequacy of blood flow the heart rate, okay, and the strength of the heart. The pulse points include temporal, common carotid, facial, brachial in front of the elbow, radial, a common point, femoral by the groin, popliteal behind the knee, dorsalis pedis on top of the foot, and posterior tibial behind the tibia close to the medial malleolus on the ankle. Okay? Again, these are risk areas because um, if those arteries get cut, the blood loss will be significant and it could result in death. Okay. Usually we take pulse in the radial artery unless there's no way to get to it. You may be asked to take the pulse of a diabetic at the dorsalis pedis because a weak or absent pulse here indicates inadequate circulation to the feet. One of the things that you see in diabetics because of the excess sugar in the blood, if it's not well treated, is a lack of circulation to distal regions, and that can result in the death of those distal regions due to inadequate blood flow. Those tissues can become necrotic and can sometimes basically rot and fall off. So this is one of the reasons why we have to control blood sugar in these individuals so that we don't have circulatory inadequacy at those points. And that goes for both type 1 and type 2 diabetes that have slightly different causes, right? Type 1 is because of lack of insulin production, period. Type 2 is the result of insensitivity to your insulin because there's been too much insulin production. So I thank you for listening. What follows are some discussions about the major arteries and veins of the body with movable diagrams to kind of orient you. Again, if you have questions, by all means let me know, and I'll be happy to help you out. I can get back via email within the day, and I will join everybody in the next podcast. I thank you very much.
Okay, so this is a tutorial on the arteries of the body. So I'll cover some of the important arteries that you need to know. So starting from the heart, I'll start with this artery here, the pulmonary trunk, which comes from the right side of the heart and pumps deoxygenated blood to the lungs. The pulmonary trunk bifurcates into left and right branches, so you've got the left and right pulmonary artery, so you can see that there. So the right pulmonary artery just passing underneath the arch of the aorta. So on the left side of the heart, the left ventricle pumps blood out through the aorta, which arches over the pulmonary trunk. And this level of the arch of the aorta where the pulmonary trunk bifurcates is the level of the angle of Lewis, so the junction of vertebra T4, T5. So the angle of Lewis is where the manubrium of the sternum meets the body of the sternum. So if I just show you that quickly. So this junction here is the angle of Lewis, the sternal angle. So that's the level of the disc between T4 and T5. So the arch of the aorta has three branches coming off, which you can see here. So the first branch is the brachiocephalic trunk. This second branch in the middle is the left common carotid, and this branch here is the left subclavian artery. So you can remember, there's a mnemonic for remembering the branches of the arch of the aorta. So ABCs, as in learning your ABCs. So A, aorta, B, brachiocephalic trunk, C, common carotid, so the left common carotid, and S, subclavian, so left subclavian. So this branch here, this brachiocephalic trunk, then splits into two branches. You've got the right subclavian here and the right common carotid. So just like you've got the left common carotid here, you've got the right common carotid here, which branches off from the brachiocephalic trunk. So just following the common carotid arteries up a bit further, they then split into another two branches. So you've got the internal carotid and the external carotid coming off the common carotid artery. The external carotid artery has loads of branches, and these supply the head and face. So you can see all these arteries on the face. These are branches of the external carotid artery. The internal carotid artery, however, runs straight up to join the base of the brain at the circle of Willis. So this arterial circle at the base of the brain which supplies the brain, and the internal carotid goes up to meet that. So next along, an important artery to note is this one coming off the subclavian, and you've got this on both sides. It's called the vertebral artery. So you've got the common carotid coming off the brachiocephalic trunk on the right side, and you've got the subclavians on either side, and you've got the vertebral artery which comes off the subclavian. So you can see the course of this artery. It runs up through the transverse foramen of the cervical vertebra. So you can see this transverse process here, and you can see this artery running up alongside the vertebral vein through the transverse foramen. So the vertebral artery runs up, and it meets the basilar artery to join the circle of Willis and supplies the posterior parts of the brain. So that's the vertebral artery which comes off the subclavian. So I'm just going to follow this course of the subclavian artery, and I'll just show you what that extends down to. So the subclavian artery, you can see it running here underneath the clavicle, and that's why it's called the subclavian. So sub meaning under, and clavian referring to the clavicle, so it runs underneath the clavicle. So the subclavian artery becomes the axillary artery, and it becomes the axillary artery at the level of the lateral margin of the first rib. So the axillary artery runs here. So the axilla refers to the armpit, so it runs in the armpit region. So if we just follow it down, so you can see the artery running down the humerus. So this artery is the brachial artery, and the brachial artery then splits into two. So you've got the radial artery and the ulnar artery. So the radial is lateral in the anatomical position, so the radius is lateral and the ulnar bone is medial. So often in clinical medicine you'll hear the words radial and ulnar referring to lateral and medial, because in the anatomical position the radius is lateral and the ulnar is medial. So the radial artery runs along the radius and is lateral and is on the thumb side, and the ulnar artery runs along the ulnar side and is medial and is on the side of the little finger. So following the artery a little bit further down, we can see the blood supply of the hand, and you can see these arches here. So this is the superficial palmar arch, and you've got the deep palmar arch. So the superficial arch is obviously close to the surface of the palm because it's superficial, and the deep palmar arch is deeper, obviously. So the superficial arch, as you can see, is further towards the fingertips, so it's more distal, and the deep palmar arch is more proximal. So I'm just going to return back to the center of the body, back to the aorta, and we're going to follow it now down towards the abdomen and lower limbs. So the aorta can be divided into 5 sections. So the bit between the heart and this arch is called the ascending aorta, So you've got this ascending portion, and then you've got this arch shape, so this is the arch of the aorta, and then you've got the descending aorta, so the section from the arch of the aorta to the point where it divides into the common iliac arteries, so down here. So that's the descending aorta. And then you can divide it into the thoracic and abdominal aorta. So the thoracic aorta is the section of the aorta which is above the diaphragm. The aorta is the section below the diaphragm. So I've just added in the diaphragm, which separates the thoracic and abdominal parts of the aorta. So you can see it looping over the ascending, the arch, the descending portion, and you've got the thoracic aorta, which is above the diaphragm, and the abdominal aorta, which is below the diaphragm. So just looking at the abdominal section of the aorta, you can see these three branches here which are coming off it. I've removed a lot of the arteries here because it makes it a bit more complicated, so I've left some of the main branches of the aorta, but I'll be covering the other branches in tutorials on the abdominal organs. So this top branch here is the celiac axis, and it has three branches. It's got the common hepatic artery, the left gastric artery, and the splenic artery. The branch below is called the superior mesenteric artery, and the branch below that, which comes off the aorta, is the inferior mesenteric artery. So the celiac axis supplies foregut structures, the superior mesenteric artery supplies midgut structures, and the inferior mesenteric artery supplies hindgut structures. So here you've got another bifurcation. So this is the bifurcation of the descending aorta, and this occurs at approximately the level of the L4 vertebra, so the fourth lumbar vertebra. And this splits into the common iliac arteries. So you've got the right and left common iliac artery. This then splits into just like the carotid arteries, it splits into the external and the internal iliac arteries. So just quickly to give you some perspective on whereabouts we are in relation to other structures, I'll just put in the bladder, so you can see where the bladder sits in relation to the bifurcation. You can see the kidneys, and I'll just show you in relation to surface anatomy. So you can see the umbilicus, and this sits at around the level of L3 to L5 vertebra, so approximate, very close to where the aorta bifurcates. So just going back to the external iliac arteries, which come off the common iliac, they then become the femoral arteries at roughly the level of the head of the femur. So you've got the femoral arteries which run down the length of the femur on both sides. So we're now at the level of the knee, and I'm just going to rotate this model so we can look at the back of the knee. So we've got the femoral artery here running down, and it becomes the popliteal artery. So that this area at the back of the knee, this bit at the back of the knee is called the popliteal fossa. So this artery is called the popliteal artery. So the popliteal artery then splits into a couple of branches. So you've got the anterior tibial artery, which branches off from the popliteal artery and runs down the course of the tibia on the anterior aspect. So here we're looking at the front, at the front of the body, so the anterior surface of the tibia, and at the back, so you can see here the popliteal, just zoom in a bit more, so the popliteal artery branches off, and you can see it winding round here just underneath the fibula to form the anterior tibial. And then at the back you've got two branches. You've got the posterior tibial, so the popliteal artery splits into the posterior tibial here. Posterior tibial artery runs down the posterior surface of the tibia, and you've got the peroneal artery, which runs laterally on the posterior surface. So just to recap, you've got the popliteal artery, which branches off into the anterior tibial, which winds round onto the anterior surface of the tibia, and you've got the posterior tibial, which descends along the posterior surface of the tibia, and the peroneal artery. So just moving down to the foot, you can see this arterial arch on the foot, which forms from the anterior tibial artery. So in the feet you've got this artery here, which is the arcuate artery, and you've got this artery here, which is the dorsalis pedis artery. And this is important because in a vascular examination you palpate this pulse. So this pulse, if I just put in the muscular system, you'll be able to see this tendon here, which runs up and extends the big toe. So this is the extensor hallucis longus tendon, and the dorsalis pedis artery is just lateral to the tendon of the tendon of the extensor hallucis longus. So those are the arteries of the body, some of the important ones that you need to know. And I'm just quickly going to show you some of the pulses that are palpable. So in a vascular examination you palpate a few pulses. You palpate one at the neck, so the carotid pulse. So you can see that this is palpable between these muscles here, so the carotid artery. At the arm there are two pulses you palpate, one just at the elbow, so you've got the brachial artery, which you palpate here, medial to the biceps tendon, and at the wrist you palpate the radial artery here. You can see the femoral artery passing through here quite superficially, so this pulse is also palpable, and this you can feel between the midpoint of the pubic symphysis and the anterior superior iliac spine. So this is the femoral pulse you feel here between the pubic symphysis and the anterior superior iliac spine. Behind the knee you can palpate the popliteal pulse. So this you can feel between the head of the gastrocnemius muscle, and in the feet you can palpate the posterior tibial pulse, which runs just behind the medial malleolus of the tibia, and as I mentioned before, you can palpate the dorsalis pedis artery, which runs lateral to the tendon of the extensor hallucis longus. So those are the arteries, some of the important arteries that you need to remember in the body.